What increases the overdose risk in substance use disorder? Imagine holding a loaded gun without knowing if it's loaded or not. That's what using drugs can feel like if you're not careful. Many factors can turn a risky situation into a deadly one when it comes to substance use. Understanding what raises the chances of overdose can help save lives. Overdose is when a person takes too much of a substance, causing their body to react dangerously. It often happens because the brain and body can't handle the amount used, especially when breathing slows or stops. Certain things make overdose more likely. For example, if someone stops using a drug for a while, their body's tolerance drops. When they go back to their previous dose, it can be too much for their system, leading to overdose. Mixing drugs is another big risk. Combining opioids with alcohol or benzodiazepines, which are medications for anxiety or sleep, can depress breathing even more. This combination can quickly become life-threatening. Using drugs alone also increases danger because there's no one around to help or call for help if something goes wrong. Using in secret or in isolation makes it harder to get immediate assistance. The strength and purity of street drugs can vary a lot. Sometimes, drugs are contaminated or cut with powerful synthetic opioids like fentanyl, which is many times stronger than heroin. Even experienced users can overdose if they don't know the potency of what they're taking. Health problems like heart or lung disease also play a role. These conditions make it harder for the body to handle the stress of drug use. Older adults and those with multiple health issues are especially vulnerable. If someone has already had a non-fatal overdose, they are at a much higher risk of overdosing again. Past overdose is a warning sign that their use patterns are dangerous. Mental health issues like depression or a history of suicide attempts can also increase overdose risk. When people use substances to cope with emotional pain, they may take higher doses or use more dangerous combinations. All these factors often overlap. For example, someone with a history of overdose who uses alone and mixes drugs is at an extremely high risk. Tolerance can change quickly, especially after stopping use for a while, and street drugs are unpredictable. To lower the chances of overdose, it's important to carry Naloxone, a medication that can reverse opioid overdoses. Using with others is safer because someone can respond if needed. Testing new supplies before using a full dose helps avoid unexpected strength. Avoid mixing substances, especially opioids with alcohol or benzodiazepines. If you're using alone, try to have someone check on you or use a monitoring service. Getting treatment for substance use disorder can also reduce overdose risk by helping manage use and supporting recovery. Learning to recognize overdose signs like unresponsiveness, slow or stopped breathing, pale skin, or blue lips is vital. If you see these signs, call emergency services immediately, give Naloxone if available, and stay with the person until help arrives. Understanding what increases overdose risk helps us take steps to stay safe. Simple actions like avoiding mixing drugs, not using alone, and being prepared with Naloxone can make a big difference in saving lives.